Hello everyone, welcome to medical video lecture series by All Learn Law team. Today we are going to talk about a very important and a very commonly done procedure in ophthalmology, that is lacrimal sac syringing. We will try to understand why a lacrimal sac syringing should be done, how to do it, and how to make a diagnosis from the lacrimal sac syringing. It is very important to know the brief anatomy of the lacrimal drainage system before we understand the syringing procedure itself. So the lacrimal drainage procedure involves, once the tears are produced from the accessory lacrimal glands as well as the main lacrimal gland, they are drained along the lid margin and through the upper and the lower punctum, which are present on the inner side of the eye. It goes through the lower canaliculus, first initially downwards, followed by the upward movement of the canaliculus, which includes the horizontal and the vertical parts. These two join together to form the common canaliculus, which opens into the lacrimal sac. So this lacrimal sac has got the main body as well as the fundus, which is the upper part. The lacrimal sac drains into the nasolacrimal duct, which opens into the inferior meatus of the nose. Normally in newborns, this opening of the nasolacrimal duct in the lower part may not be patent, and that is a very common cause for watering in the newborns. This generally tends to open up with time in about 90% of the patients, just on its own or by doing some massaging. So any pathology within the punctum or canaliculus or the lacrimal sac or the nasolacrimal duct, or any pathology within the nose causing obstruction to the opening of the nasolacrimal duct, can cause watering. Obviously, we need to exclude any irritative pathology within the eye, like any foreign body or any corneal ulcer or any pathology in the conjunctiva can cause watering, and these all need to be excluded before doing a lacrimal sac syringing. So how to perform this procedure? First and the foremost thing is explain the procedure to the patient. Make the patient to lie down. Put a drop of local anesthetic into the eye. There is a special lacrimal cannula which is relatively blunt, and this is attached to a 2 ml syringe, which is normally filled with normal saline or distilled water. Insert this into the lower punctum. Go in downward direction first for about 1 to 2 millimeters, and then go upwards a little bit or horizontally to go into the canaliculus. Once you reach the hard part, then inject the fluid into the lower punctum. Once you inject the fluid, ask the patient if they can feel any water in their throat. Remember not to do the sac syringing in a patient who has got acute painful swelling in the lacrimal sac area or any acute dacrocystitis. Generally try to avoid doing a sac syringing in an eye which is acutely inflamed due to any infective pathology. Now coming to the interpretation of the lacrimal sac syringing. So the possibility is the patient may tell they can feel some water in their throat, which means the drainage system is patent under the test conditions. That is, here you are injecting the fluid under high pressure. So If the system is patent on sac syringing but patient still has got watery eye, then we need to look into the reason for this, which can be a functional obstruction, and this needs further evaluation in the form of tests like Jones test 1 or 2 and lacrimal dacryocystogram or lacrimal scintigraphy. If the patient says they can't feel anything in the throat, then it means the drainage system is blocked. So the level of obstruction can be determined based on where you feel the difficulty in inserting the cannula, or depending on from where the fluid is regurgitating. A hard stop basically means when you insert the cannula, then you feel that the cannula is hitting some hard structure, which is the lacrimal bone. So once you are able to reach the lacrimal bone, it suggests that the canaliculus, punctum and the sac are patent, but the blockage is within the nasolacrimal duct, which is below the lacrimal sac. The other possibility is you may not be able to insert the cannula into the punctum itself, which means the punctum is stenosed. Again, that is a reason for the watering. Obviously, you can make this out based on clinical examination, and you don't need to do the sac syringing. The soft stop means you are not able to pass the cannula into the sac and it's not touching the bone. So the obstruction will be somewhere within the canalicular system. So this is obstructive pathology. Once you inject into the lower punctum, and if the fluid is coming out from the upper punctum, it means the blockage is in the common canaliculus. So the fluid is going from the lower punctum and it's coming out through the upper punctum. So this is in brief about the lacrimal sac syringing. I hope you liked the presentation. Don't forget to like, share and comment on the presentations. Thanks for watching and stay blessed.